Good evening, and thank you for joining us. We're going to begin with breaking news that is just coming out of an emergency meeting at the CDC. Tonight, the scientific committee advising the government on vaccines says it needs more time to evaluate the risks associated with Johnson & Johnson's coronavirus shot, essentially extending a nationwide pause on using the vaccine for at least another week. The FDA and CDC temporarily halted use of the single-dose vaccine nationwide Tuesday after 6 women came down with an extremely rare blood clotting disorder. One of those women died. The committee had been expected to lift that pause and issue new warnings about possible reactions to the vaccine. Instead, members said they just don't have enough information to make any decision. Health officials point out more than 7 million people have gotten the Johnson & Johnson shot without any issues. But tonight's move is setting off a firestorm, raising more questions about the safety of that vaccine and creating more doubt among those who fear getting vaccinated at all. CBS's Mola Lenghi is going to lead off our coverage tonight from a vaccination site near Miami. Good evening, Mola.
Well, good evening, Norah. States and vaccination sites are still dealing with the fallout from that Johnson & Johnson vaccine pause. And a panel advising the CDC just gave them some potentially more challenging news. This as we're learning more about those 6 women who suffered those blood clots.
Tonight, a CDC advisory committee saying they need more time to assess data and risks on the Johnson & Johnson vaccine, and they expect the CDC will keep the pause for now. After 6 cases of blood clots were reported in women, all aged between 18 and 48.
Right now, we believe these events to be extremely rare, but we are also not yet certain. We have heard about all possible cases.
And now we're learning new details about the women. All reported headaches as a symptom. None were pregnant. Half had obesity as a pre-existing condition, and only 1 of the 6 white women was taking the hormones estrogen and progesterone. Tonight, 3 remain hospitalized, with 2 in the ICU. And we now know the woman who died was a 45-year-old from Virginia. Only 2 of the women have been released from the hospital. 4 of the 6 had received heparin, a standard treatment for blood clots, but harmful for the type of clots they had.
Because it could be dangerous and make the situation much worse.
I don't want to, put anybody at risk here.
Pharmacies and vaccine sites are scrambling, and so are Americans.
I was definitely excited to finally get it, and then just kind of got slapped in the face and say, hey, no, there's, you have to wait again.
The pause could affect some communities more than others. Rural residents, students, and the homeless, populations the Biden administration's vaccine campaign was targeting with the J&J vaccine. More than 7 million J&J doses have already been administered, but they still account for less than 5% of the total doses given. The U.S. is now averaging 3.3 million daily doses.
I want to be clear that we have more than enough Pfizer and Moderna vaccine supply to continue or even accelerate the current pace of vaccinations.
But public health leaders acknowledge that vaccine hesitancy remains a concern.
It's going to be a hard sell for not just Johnson & Johnson, but for any vaccine.
People need to know that the system is working for them, that we're being vigilant. And even though this wasn't an easy decision, it was the right decision.
Well, here at this site just outside the Miami Dolphins football stadium, more than 1,600 Pfizer vaccines were administered just today. But still, a major concern here in Florida, as it is across the nation, are underserved communities. Many of them were relying on that Johnson & Johnson vaccine, and it's likely they will be further squeezed as that vaccine hangs in limbo. Norah.
That really is the story. Mola Lenghi, thank you.